Good evening, everybody. Thank you so much for joining the University of Warwick Masters in Public Health and Health Promotion. We're delighted to see so many of you participating today, and thank you for joining us. Just to let you know about the running order for today, I'm going to have a fireside chat about public health with our program director, our leader, and that's Dr. John Fletcher. So he will be having a chat with me just about, I suppose, the curriculum and a little bit about public health in general and his own career and the kind of overall distinguishing features of this particular master's. And then I will do an overall presentation on the kind of granularity and detail of the programme around the curriculum, entry requirements, fees, etc. At the end, we will open to Q&A for around 15 minutes. So we will be asking out loud the most pertinent and regular questions that come in the chat. But please feel free to put your questions in the chat in the interim anyway. We'd be delighted to have those questions and to answer them. And we've plenty of our team members here to do just that. Just before I begin, I'm going to introduce you to Dr. John Fletcher, who's our program director. So John has the most amazing career. He studied his medicine in Cambridge University. He then did his master's in public health in Oxford University. He was assistant editor in the British Medical Journal and then progressed to the primary care editor and then later clinical epidemiologist in the British Medical Journal. He then was the editor-in-chief in the Canadian Medical Association Journal. And he has just had a wonderful career in academia, in editing and in public health. And he also has, just because he is such I suppose, wonderful academic. He did a master's in Harvard as well. And so we're privileged to have him as part of the iheed team for many years and privileged to have him as the program director on this master's in public health and health promotion. So John, just before we get started, I just wanted to ask you a few questions really about your own career in public health and why you chose a master's in public health.
Sure. Now, you've really embarrassed me now, Rebecca. I really hate talking about previous career and so on. However, I mean, I trained as a doctor some time back, and like most doctors, loved sick patients because they're the most interesting ones, aren't they? Partway through my junior doctor training, after I'd done infectious diseases at Oxford, I took a short job in Africa. It was in what was then Zaire, or the Central Democratic Republic of Congo, as it now is, because I support charity work and I wanted to see what it was like to be a doctor in that setting. And of course, I loved treating malaria and typhoid and TB, all these things I'd learned about but not seen very much of. But I was introduced to public health through that job because I saw that it was the public health nurses who were educating mothers who were saving women from difficult labours, that they were getting the immunization rates up for the children so they didn't get measles and neonatal tetanus because they were having their vaccinations. And also there was an agricultural training project hospital that I worked at to help farmers to produce better crop yields and better crops. And I saw that actually in terms of saving lives, promoting good health, doctors don't do much. They treat disease. There's a lot more stuff to be gained from public health. So I came back to the UK and completed my my junior doctor training, signed up for public health medicine training in the UK, and as part of that, did a master's in public health at Harvard. In fact, my public health has taken me down a slightly different line, as Rebecca said. The public health practitioners could be doing a wide range of things from infectious disease programs, TB programs, managing hospitals. What I've done is used my research knowledge to promote good research in journals. So I've worked in medical journals really since 2000. Gosh, yes, that's 20 odd years now. And joined iheed in 2016 because of my interest in medical education, and particularly reaching out to countries that don't have access to high quality master's programs. The reason I joined the company was I was very impressed with the quality of the online training and the software. So that's why I'm here. My main job, as I said, is with the British Medical Journal, but I do this for iheed too.
Thanks, John. Can I just ask, why is public health highlighted as one of the few non-clinical areas of healthcare which can lead to a consultant position?
Yeah, that's a good question, Rebecca. I think it's because public health's actually a bit ahead of the curve. Because the reality is that there are lots of things that doctors do that other people could do as well. Doctors like to hold on to their key skills, but a lot of nurses in emergency departments are doing the setting fractures and the stitching up minor wounds. A lot of physician's assistants and operation department assistants are helping with anesthetizing patients. And I think as you look around various areas of medicine, there are non-medics doing what you might say is some of the medics' jobs. Public health is a specialty that is quite egalitarian. We talk about inequalities and equalities. We want to increase opportunities for health and well-being. And so I think it's not surprising that in the UK, at least, consultants in public health medicine may be appointed from outside of medicine. So consultants in public health, once they have received the full training, don't have to be doctors. I'm not sure to what extent that's the case in other parts of the world. But certainly where I worked in Africa, there were a lot of people who were doing a lot of the jobs that you might think of as doctors' jobs, but without the qualification of doctor.
Okay. And John, one question I really want to put to you today is what differentiates this particular master's from the traditional MPHs that have been out for a number of years, for example, and offered by other institutions?
Well, I'd like to focus on three things that are different about this Masters in Public Health. I think the first one is online. And that you can see online masters in other places. I think what's different about this one is that it's not just existing lectures recorded. It's not just a video feed of what the campus students are getting. All of the content for this course has been bespoke and created specifically to be interactive and to teach online. The second thing that I'd like to highlight is that although we used University of Warwick learning outcomes and they have closely looked at the curriculum, the course itself has been designed from scratch in the last year. And so we have selected a range of topics that speak to modern public health, and we'll be getting on to the course structure later. And then thirdly, I can't remember what my third point was, but it'll occur to me in a bit.
It's the contemporary curriculum, maybe designed in 2021, because I know we're integrating new aspects into our curriculum that maybe don't exist in other MPHs.
I think, yes, that's it. It's the fact that we're a Masters in Public Health and Health Promotion. So you'll see a lot of MPHs, but not many of them have health promotion as well. And we took this because a lot of public health is around disease management. Often it's about management of hospital programs and communicable disease control. But a lot of promoting health is around the behavior of individuals. Diet, what we eat, exercise, the exercise that we take, and the environment that we live in. So a lot of public health is about educating and changing the way people behave. And that might be through emphasis on what individuals do, but it might also be on nudging people through policies or through taxes or through the way the environment is designed in order to get them to make healthy choices. So this is the other component of public health and health promotion.
Excellent. And John, I suppose my last question for you is, what are the career opportunities, the career trajectory after completion of this master's?
Well, I think you see people with a master's in public health do crop up in a wide range of places in healthcare. I think it's fair to say that you would bring to your career whatever your previous qualification was. So if you come in from environmental health, then an MPH will sort of help progress your career within a local authority. If you come in as a doctor, you might find that this is a progress into a management position within a hospital or health maintenance organization. Equally, you might decide to be a public health practitioner, where you are putting together programs either for government or non-governmental organizations, or one of the big international organizations such as WHO. And again, a broad spectrum. This can be a way of enhancing the career that you're in now, or it can be a stepping stone to going sideways. So clinical people especially might move away from individual patient care into programs and population programs. Equally, I mean, for myself, it's different in that this brought me into research. So I have concentrated on epidemiology and statistics, and public health was my way into this whole academic career. So people do take this on to PhDs and university posts.
Super, thanks, John. So there is a wide array. Obviously, there's national and local and national government positions and international organisations, the WHO, UN, OECD, research and academia, faith-based charity groups, industry, banking, finance, voluntary bodies, AMREF, charitable organisations and foundations. There seems to be such a wonderful kind of direction you can go, or you can simply remain in your own position but enhance perhaps promotional opportunities based on, rather than individual patient care, population patient care.
Rebecca, I think you've got a list in front of you and I didn't. That's why you said so much more.
I would never cheat like that, John, never. But it's so exciting. Thank you, John. That is wonderful. What I'm going to do now is I'm just going to share a presentation about the curriculum and just give you a little bit more detail around the program itself. So let me see. Now, so if you can see my screen, that'd be great. Can you see that, guys? Is that coming up for you?
It's blank, but there we go. Yes, we can see it.
Can you see it correctly there? My screen went funny itself for a second.
Mind you, it's gone again now, Rebecca.
Apologies, guys. I'll just, let me see that. No. No. Now, can you see that?
Yes.
Super. Okay. So I'll just put this into slide mode. Now. Just before we begin, I suppose I'm just going to echo John's enthusiasm for public health. I think in the wake of the pandemic and the fact that we're still living through it, There's been such a huge newfound respect for the work of a public health professional. I think it's just what they have achieved and what they have gone through is akin to what the frontline clinical healthcare workers have gone through in terms of workload and pressure. And what they've achieved is genuinely phenomenal. I think the WHO now has an estimated deficit of over 500,000 professional public health workers. And so it's imperative that we upskill more and more professionals to go into this space, to go into public health. And what they've achieved during the pandemic, and quite rightly, the clinicians and the healthcare workers in the front line have been applauded, and correctly so. But what the public health professionals have done in terms of national health promotion strategies and just, I suppose, making those guidelines very understandable and palatable and just easy to embrace by a national population in terms of how to handle the pandemic. They've been involved in the rapid case identification and contact tracing, isolation of cases, quarantine and close contact. And they are the ones that have amassed the databases for disease surveillance, risk factor assessment and disease mapping. So now more than ever, I think we all appreciate the work that public healthcare and public health professional and the intrinsic and instrumental part they have to play in global health. So just to tell you a little bit about iheed, you might have heard us talk about iheed, and you might be a bit confused going, how is that, what does iheed have to do with the University of Warwick? Essentially, we are what's called an OPM, and that's an online program management company. And what we do is we create and deliver the online programs for Warwick Medical School. And Warwick Medical School has, and I will talk about their rankings, but an exceptional reputation both at a national level in the UK and at a global level under the QS rankings. So we are their program creator and deliverer of their online programs in the medical school in the University of Warwick. We are an Irish company, and we were now recently a division of Cambridge Education Group in the United Kingdom, but we were originally established by an Irish family medicine doctor, and we are guided and steered by people like Dr. Fletcher and our CEO and a wonderful group of clinicians and healthcare workers. We serve governments and healthcare ministries globally. With respect to Malaysia, we have an agreement with the Ministry of Health in Malaysia. We work with RUMC in Penang in terms of building family medicine capacity locally under the MINT-FM Family Medicine Training Program in Malaysia. And we work with the College of Family Physicians in Singapore. We work with the Saudi Health Commission, or Saudi Commission for Health Specialties. We work with HMC in Qatar. And our whole mission and social mission is to build family and medicine capacity worldwide and to upskill clinicians and healthcare workers at a global level. We are health education specialists. Some online education organizations, they will do everything from engineering, business, all subject areas, but we are health education specialists, and we absolutely embrace and understand at a very deep level how to educate healthcare workers. We have over 400,000 course completions to date on our learning platform globally, with over 40,000 enrolled clinicians globally on our programs. So you may not have heard of us, but we do have quite a large global footprint and a lot of traction and a high level agreements with ministries of health at a global level. So just in terms of the University of Warwick, they are ranked 8th in the UK and 62nd in the world. So that's under the QS rankings. They're a member of the Russell Group, and the Russell Group are the research-centric Ivy League equivalent universities in the United Kingdom. They are the campus MPH in the University of Warwick is actually ranked 2nd in the UK now and 12th globally. So the University of Warwick itself has an exemplary reputation in public health at a research level and also at an education level. They're world leaders in public health and health promotion, and the programme is accredited as a level 7 UK Masters. Just to be very clear, nowhere on your certificate does it say blended or distance or online education. You get the exact same qualification as if you were to fly to the University of Warwick and do this program in a face-to-face environment. So just to let you know, on your parchment, you get the full university qualification with no differential whatsoever. At iheed and at the University of Warwick, we pride ourselves in our wonderful global and international mix of tutors and contributors and subject matter experts on our programs. One size does not fit all, and particularly in public health and global health, where you are looking at, you must look outside your own boundaries and your own borders and rely on subject matter experts across the globe. And that's why we bring in our tutors and our academics from everywhere. And we're very proud that we do that. So for example, Dr. Sadaf Leans, she's Saudi Centre for Disease Prevention and Control. Dr. Saran, he's the associate professor within the University of Warwick. So he is our champion and our program lead in the university. Dr. Katie Reid has, in previous years, she has run the MPH in the University of Manchester, she was the course director there, which is an exceptionally popular program as well. Dr. Tim Feeney is British Medical Journal. Dr. Ulrich Glasser is the World Federation of Public Health Associations. He's head of that. And then Gianpiero Favarto is Director of Postgraduate Studies at Kingston University in London. So you can see there, we take the very best globally from around the world to join our academics and to join our tutor group to make sure you're getting a very good and deep perspective from different perspectives and different geographies. And when we expand, like we do in all our programs, for example, our MSc in diabetes, we also hire local experts. We have an expert, senior endocrinologist in Malaysia that's on our tutor group for the Malaysian cohort, and also in the Gulf we have leading experts in the UAE in diabetes care. We do that intentionally because how you treat and how you train individuals, we must localize and we must understand some of the challenges at a local level as well as a global level. So I'm going to just go into the curriculum now, John, and I will actually just refer to you in terms of your own expertise and explain the basics around the modules. So if you want to just give us a little bit more granularity around what to expect in the first semester, which would be the postgraduate certificate.
Sure, thanks, Rebecca. So there are two modules to the taught materials for the diploma in public health, and then one module at the end for the full master's program. That's a research module. So the two taught modules are the science and the art of public health. And public health has been described as the science and the art of preventing disease and promoting health through the organized efforts of society. So it's not about just individuals, it's about organizing society and other people in order to deliver the programs and the environment that promotes health. But there is a science to it, and we cover the science in the first three modules, which make up the first semester. And each module has 6 weeks of content. You can see those broken down under each of those module headings. So the first module, we start off with an introduction to take people who think about, and we're assuming that you think about disease and individuals, and to start to get you to think differently and to change the culture towards thinking about populations and the public. So those introductory modules will introduce Communicable Disease Control, which I think is one of the early areas where public health made a difference 200 years or so ago in protecting water supplies and stopping the transmission of communicable diseases. We introduce you to routine measures of health burden in the Global Burden of Disease project. And we introduce you to the idea that in order to change society, we may need to influence health policies, not just health policies, but policies in other areas of government that affect health. Then public health action is about sort of grassroots and community development. Module 2 is the scary stuff for some people, the epidemiology and the statistics. So we do need to understand things like relative risks and probability distributions and percentages. The actual demand, I think, isn't as heavy as you might think. You need to be able to add, subtract, and divide comfortably and understand charts, graphs, and the display of information. Although we will be using statistical packages, and JASP is the one that we use, the emphasis in this module and for the whole public health course is on understanding and interpreting research, not on doing and analysing. If you go on to do the masters, then there'll be more emphasis on data handling at that point. And then the third part of the science is social determinants of health, and how does society influence health, and how do we influence society? What are the levers that can be pulled in order to change society so that it becomes more healthy? So that's about organisation of healthcare delivery, health infrastructure, inequalities in health, how to tackle them, and some introduction to health policy. So that's the first semester, Rebecca.
Oh, sorry, second one.
Do you want me to carry on with the second semester?
Yeah, I think, am I right in saying, John, that the first semester, a lot of the subjects that are covered would be quite standard on the fundamentals of a good public health master's?
Absolutely,
but
yeah.
The second semester is where our real uniqueness is in terms of the I suppose, making it a very current curriculum and bringing in health promotion, areas around healthy cities, food, nutrition, all those, race and gender inequalities. These are things that are so current and so relevant that, and some, I suppose, traditional MPHs or Masters in Public Health have not covered to the same extent. Is that right in saying that?
Well, I think health programs, MPHs that have been going for a long time, may not have modernized. The curriculum for this course was designed late last year. So it's bang up to date, and the hot topics you will see there, particularly under international health and sustainable development. We do cover disasters, major events, sustainability, climate change, gender, race inequalities, huge drivers of health these days. The WHO's Healthy Cities initiatives, food, nutrition. So that's a big chunk of what is international and up to date and hot.
And global mental health as well, I suppose. There's such a close emphasis in the pandemic world, but
yes,
an increased emphasis irrespective in terms of global mental health. And I think it's really important to have that in the public health masters. Yes,
health promotion. Again, we cover quite a lot more in this module of the science and how to bring about individual behavior change and how to promote health being a wider concept than just the absence of disease, but a positive one. And often this is about empowering individuals to understand and take charge of their health. And then the last module, we recognize that a lot of people outside of UK, USA, Western Europe, with their MPHs, would be going in at quite a senior level, tackling large program budgets and managing organizations. So we give you the skills to understand budgets and financing, spreadsheets, balance sheets, health economics, when things are cost effective and how to assess that.
Yeah, that's wonderful. I suppose you often see in leadership programs as well that so few, particularly clinicians, we respect there's a huge interprofessional, there's more than clinicians that would be joining this program, but they never have really any training in terms of economics and, essentially financial management in their undergraduate studies. So if they are in a leadership role, it's really important that they have an understanding of that and an ability to understand finance and I suppose just health economics in general.
Yes, Rebecca, thanks. And the other thing that people in decision-making positions need and often don't get is a framework for deciding, are you doing any good? And good is defined in many different ways, and we will be talking about ethical theories that help you to decide whether a program is good and doing the right thing or not. And that's can be more sophisticated than simply the greatest good, greatest number. There may be other things to consider. So this second module is about the art. It's about the practice of public health, applying those principles from the first module. We would expect most people to want to complete a postgraduate diploma, but there is the opportunity to stop at the end of the first semester at the certificate level with the basic science, but add the art, and that leads to the diploma. Add the master's program at the end, the research, and you have the full master's in public health and health promotion.
Thank you, John. So essentially the science is the postgraduate certificate, the art is the postgraduate diploma, which is very, very current, embracing new theories and new developments in global health. And then we will go into essentially if you want to go on to do the master's, which really has a major currency in a career in public health, this is what it looks like. We do a thought module around research methodologies, and then we go into essentially the participant in the master's will choose a research area, they'll do their literature review, they'll go on to develop a research proposal, they'll gain ethics approval for that proposal, they'll collect their data, they'll work with their supervisor, analyze their data and write their paper. And where the University of Warwick differs from many other institutions, and this is something that we're all very excited and impassioned about, is that we don't ask our participants to write a 10, 15 or 20,000 dissertation that will sit and gain dust and never be read by anybody except the individual and their supervisor. The output from this master's is very, very practical. Essentially, we are asking you to write a 4,000 word journal article and a conference poster presentation. So the journal article is worth 80% and the conference poster presentation is worth 20%. From the perspective of the individual who is creating this journal article, we will be asking you to submit that for publication in national, international journals of repute. And that has essentially gives the circuitous value of adding to the body of knowledge in public health and adding more research into public health in the area that you are very passionate and you want to do your subject dissertation in. But from I suppose, the individual's perspective, it's a tangible CV enhancing piece at the end of your qualification. So if you're published at the end of your qualification, it's such a wonderful thing to add to your own biography and your own career trajectory in public health. So we're very excited about that pragmatic and practical output from your research and from your master's. So that's an additional 10 months after the 12 months of the PG dip. So just
the other thing to say, Rebecca, about that assessment is that it's not actually an easy option to do a 4,000 word journal article. It's slightly harder than writing 10,000 words.
Yes.
The 10,000 words thesis demonstrates all the steps that you took and takes the examiner through by the hand to say, I've done all the right things. The journal article is actually harder to write because it's to communicate to a professional audience the research that you've done, what you've found and why it's important. But actually, it's a far more useful skill to write succinctly and have your work published than
And
to write out loud.
it is very much a science and an art within itself. And we would hope that someone who is trained to write these publications, John, would go on and continue to do more in their career thereafter. So we're giving them a wonderful basis to go on and publish further. Would that be correct?
Yes. Or to write management reports.
Exactly.
Succinct, clear writing is a valuable skill. But I would say that I'm a journal editor.
So what does it mean for the student or the participant on a day-to-day basis? We have very small groups. There's a maximum of 20 to 30 participants in one group. So even though if we have 150 students on the programme, you will not know that because you will only be aware of your own group. And we divide the groups by time zone. So there'll be a maximum of 30 in each group. We have 6-week thought modules, as you saw in the PG Cert and the PG Dip. So there are 6-week modules, and then we have a break in between of 2 weeks where you do your end of module essay. We have personal commitment, manageable and clinical workload, and then we have strong support from our wonderful team in academic affairs in terms of the mentors and in terms of the programme leads. They are there, you will know them by name. They're on every single tutorial. You will get to know them so well. And they reach out to them. They're just so responsive and so student-centric in terms of their mentorship and approach and how they deal with the individuals. And, you know, you're so not a number when you become part of this program. You are a name, and we will know you intimately by the end of the program. So how does it work? So there's a comprehensive online orientation. So that kind of refreshes your writing skills, gives you the timetables, what to expect for the whole, and gets you used to the learning environment. We've the weekly discussion forum, and that will be a topic that's on your learning outcomes for that week will be discussed in the discussion forum, and your tutor will moderate the discussion forum. And we've weekly online live tutorials. They are a wonderful way to get to know your peers. It's not like today where it's very didactic and we're just presenting at you. We don't believe in that. We're very discursive. It's all about open communication between you and your peers and learning from each other as much as you're learning from your tutor. So that's very important in the weekly live online tutorials. There's a direct correlation between success in the program and participation at these events, at the live tutorials. And then there's continuous assessments and an examination. So there's a 2,000 word essay at the end of each module. And then there's an online examination as well at the end of the semester. So they're predominantly MCQs. So the online experience, as John he said it so clearly, but there's so many masters in the height of the pandemic and so many qualifications that were hurriedly put into an online environment because they had to be, and understandably so. But there's an awful lot of talking head videos and Zoom conferences and then just downloadable PDFs. And that's a very, very staid and challenging way for a person to learn by distance education, and it's quite isolating. We have the most impassioned and dedicated team of professionals who are instructional designers, engineers, project managers, and they designed the curriculum and bespoke your experience specifically for online delivery. So it's taking very complex information and giving it to you in a very palatable way. There's a load of interactivity, there's hot topics, there's loads of engagement, there's quizzes, there are links to the very extensive repository and libraries. So when you're reading about a particular area in that subject of contact that week, you can click into the reference and click into the library to see that particular journal article in detail. There's just a lot of interactivity and a lot of time and effort has gone in to make sure that this is a very easy way for you to digest information. Of course, it's mobile ready, fully responsive. So if you can't get to a desktop machine, of course, you can look at it on your mobile as well. And it's just highly visual and interactive. And it really is, and it sounds conceited, but I've been in education myself for over 20 years. So I do know, and I have seen the very worst and the very best of online education. And this is the very best in terms of just the little details and the interactivity and the engagement and the enjoyment that you will get from this online learning environment. And
Rebecca, I think it's just worth saying that the things that you've been showing on this carousel going around are screenshots of our learning materials. They're not slides for a presentation. They're things that you actually see in the learning materials.
Yes, and they're fully clickable, and if you click on any of them, they're interactive, they expand, they give you more information, they give you links to the library, and there's, as I said, there's hot quizzes and topics, and it's just a very nice way for you to progress through complex information. We do have, of course, expert videos from international key opinion leaders as well as part of that, but they're usually kept quite succinct, quite short and to the point. So in terms of your support, as I alluded to, Dr. Fletcher is here with us today and the program leaders, and Dr. Kunal Patel, your tutor network that you'll be on your weekly tutorial. They're international, regional and local. We have a course management team and technical support, and the course management team are exemplary in terms of looking after you and making sure that your needs are met. And that, you know, the fact that we have put so much effort into this online learning experience also means that we rely heavily on analytics. So we can see every screen view, every minute of participation by each of our students on our program. So if they go below a particular mean average of interaction on the program, they'll be flagged. And we will make a proactive reach out to that individual to see if they're okay. If they, you know, and that's a wonderful way of intervening early if someone has just lost a little bit of interest, or their time is so precious and they haven't given the correct level of attention to the program. We reach out to them proactively and see if we can get them back on track and make sure that they don't lose out on graduation. So that's another added benefit to online experience that isn't there in a face-to-face environment. In terms of the student experience, in the iheed programs, we have 500 plus students from 36 countries. Actually, I think that's 56 now. 88% student engagement across all of our programs. There's 100% positive feedback on our program support and organisation, because we run questionnaires every semester to ask for student and participant feedback. We have a 92 pass rate on our existing programs, and that's not because we're lenient markers, be assured we're not. It's because of the caliber, I think, and the professionalism of the participants that participate on our programs. They are usually between late 30s, mid 40s. They are working professionals and they understand what a master's in public health, for example, can give them in terms of career promotion. So they're dedicated, and it's more of a reflection of their success than our leniency that pass rate is so high. And
Rebecca, I think just something to emphasize about the exams is that the exams are overseen by the University of Warwick and an independent external examiner. So these are real pass rates. These are not made up. These are independently assessed and overseen.
Correct, John. And you might also be asking in terms of all the exams are online as well, and they're proctored remotely. So you have an individual from somewhere in the world, usually the US, who will actually be watching you remotely doing your examination, and it's an online proctoring service. So it's a way that you can do the exam in the comfort of your own home. So it's wonderful not to have to do face-to-face whatsoever, and it's an exclusively online experience. In terms of the program outcomes, essentially it's a prestigious academic award from a top 10 UK university, a Russell Group university, and in the top 100 in the QS rankings globally. It's academic requirement, public health consultant training. It's excellent preparation for the Faculty of Public Health Diplomat and final membership examination, and then enhanced abilities in critical appraisal and research and publication. So just how
can I just speak a little bit to that? Sorry, Rebecca, it speaks to one or two of the questions that we've had about to what extent is this recognised as training in public health? So this is a master's in public health, which is it's a university. Well, what it says, a master's in public health. So anybody who is looking for a UK university qualification in public health, this is it. This is absolutely at the level of any other MPH in a UK university. It's fair to say that if you wanted to train in public health medicine in the United Kingdom itself, you would have to pass the professional membership examinations of the Faculty of Public Health. So getting an MPH from anywhere in the country would not qualify you to be a consultant in public health medicine in the UK. You would have covered a lot of the exam syllabus and you'd find the exams easy to take, but the faculty themselves oversees their own academic standards. Now, around the world, it will vary between countries as to what level of exemption and recognition they give to other university MPH programs. But that's where this master's sits. The content is good and will give you good training and preparation for a career in public health. But in terms of recognition of the accrediting body in each country will vary. I hope that sort of speaks a little bit to some of the questions we've had.
Absolutely. And we have, just to let you know as well, for any doctors from Malaysia who are on this participating today, we do have a high-level agreement with the Malaysian Medical Association. I'll talk to you in a little bit more depth about that, but they are the ones that would be the regulator for CME recognition in Malaysia, and so this program will qualify for that CME recognition if you are a doctor in Malaysia. So just how to join the program. In terms of the entry requirements, you do not have to be a clinician. You have to hold an honours bachelor degree granted by a recognised institution under NARIC. Ability to complete a program conducted through English. Because you are not migrating to the United Kingdom for a face-to-face qualification, you do not have to have an English proficiency test like IELTS or TOEFL. Essentially, we just need to see that you are at a high level of English to be able to participate on the program. You will need, in terms of the application process, your degree transcript, a personal statement of 500 words, no less than 500 words, an employer or an academic reference letter, and then a photo ID. That has to be a legal photo ID, be it passport or driver's license or national ID. Now, the most important slide for many of you is the program fees. Just to let you know that these are LMIC pricing for this particular audience. The price for the global program is a lot higher. It's 12,000 sterling. So it's a significant reduction for the masters for LMIC countries, and we're delighted to be able to do that for you. So the total price is 9,000, but we do have an early registration and an early registration plus early payment reductions in the fees to reduce that price further. So if you do pay your deposit by, and I know that the deadline is quite tight now, that is next week, by the 31st of August, you get a very significant reduction in your fees. Or if you just want to start in the postgraduate diploma and then consider going on to the masters, the fees are a lot less again. So that's 5,000 sterling. Early registration is €400 off that if you pay before the 31st of August. And there's an additional €200 if you're paying upfront, essentially, an upfront payment as well as early registration. So that's very, very significant fee reduction. If you were to fly to the University of Warwick and participate on this program, it is 24,000 sterling per annum over a 2 or 3 year period. So that is very significant price differential. And we want to do that, and we're happy. It was part of our social mission to reduce those fees very significantly for LMIC countries. And there are also monthly payment options available. We have the exceptional team of education advisors, and they are on this webinar today, and they will be reaching out to every single participant on this webinar to talk to you personally and see if you're happy with the content that you received today and how to, and if you want to progress with your application. But they can talk to you in detail about the payment, flexible payment options, the early bird, early registration, and of course the monthly payments as well. So there's a lot of flexibility there in the program fees. Just to summarize, but as we finish up, so it's a 12-month, it's 22 months altogether. The first section, the PG Cert, is 6 months. Then there's an additional 6 months for the PG dip, so 12 months in total for the PG dip. And if you want to go into the full-on Masters in Public Health and Health Promotion, is 22 months in total. And the Master's as a standalone is 10 months. The next intake is on the 24th of October, and I will say that places are filling exceptionally fast. Just because it's online doesn't mean that we just enroll in without any type of caps. We cap every single jurisdiction and geography that we enroll in to a maximum of 30, and places do fill very fast, and we do get oversubscribed for every intake. So I would just say, if you are interested in securing your place, try and pay your deposit at your earliest possible convenience. And if for whatever reason, if your application was refused, or there's extenuating circumstances, that deposit can be refunded. And so we will be reaching out after this webinar with a recording of this webinar, and also the application link and the pay deposit link. And as I said, if you pay before next week, before Tuesday, you will get a significant reduction in your fees. But it is innovative, it's designed for online, it's practical and career enhancing. But the most important thing that we haven't really mentioned is it's fun. That's one of the things we get back from feedback from our participants all the time. They get to know each other so well at the weekly tutorials. They set up WhatsApp groups that exist long beyond the program, and they get to be very genuinely a wonderful close community of experts in their field. And they have great fun. They chat, they come on early to the tutorials and chat to each other. And it's really important that we inject that element of enjoyment into our programs, and we're delighted to do so. So that's it. I will now just finish the presentation there and just see if we have any other questions on the chat that we haven't answered so far. James or Nullig, is there anything that we need to ask out loud that hasn't been covered in detail so far?
I wouldn't mind talking a little bit more about public health training, because I see there's a bit of an ongoing chat about that. So if I wanted to be a consultant in public health in the UK, and indeed I am, the pathway into that is a 5-year training. And that is a mixture of academic training and on-the-job practical training. And that 5-year program is overseen by our medical faculty of public health, and they set processes and examination standards. Now, a MPH, a Masters in Public Health, will not exempt people from 5 years of training in the UK to become a consultant in public health. It does provide a very firm grounding in that initial academic part of the program. Now, if someone does a Masters in Public Health in the UK and wants to work in a university as a lecturer, say, in public health or researcher, then an MPH would get them straight in. They wouldn't have to have other qualifications. So if I can say that that's probably similar in other countries. The other countries will have training programs that their local professional oversights and bodies have set with requirements. And it's unlikely that an MPH, 1 or 2 year MPH from anywhere in the world, will satisfy all of those training requirements for every country. But if you have done an MPH, this MPH from Warwick, you would be in a good position to apply for an academic post. If there are jobs where they're looking for graduates with public health training, then you'd be in a good position to apply for those. In many of the organizations that I've talked about, the NGOs, WHO, international organizations. In terms of being an accredited public health specialist in your country, you would have to see what the local requirements were. I can't be more specific than that, I think, for each country.
Thanks, John. James, is there anything else in the chat that we haven't covered?
No, I think John just covered most of the concerns that people had just there in his response. So I think you've covered everything.
Wonderful. Super. Yeah.
Something else, I just seen another one. If you're not a doctor or a nurse, can you do an MPH? Of course you can. Lawyers, business people, so long as you have a bachelor's degree, that is the only course prerequisite. I guess if it was a bachelor's degree in French language, you might struggle with some of the technical and scientific aspects. But so far as the University of Warwick is concerned, it's a master's program. You must have a bachelor's degree to start with.
Yes, a recognised bachelor under NARIC. And just Taliga was there asking, can I become a lecturer? Many people who do that, like John himself, go into a world of academia once they have done a master's in public health. So it is feasible to go the route of academia after a master's in public health.
Absolutely. It'll depend on your CV and experience, of course. We're not guaranteeing jobs.
You're welcome, Taliga. I'm just wondering, I think we've covered everything else, so that's wonderful. What I will say is thank you so much to everybody for participating today. I realise it's quite late for everybody in Malaysia and you're exhausted and you're going through a lot like the rest of the world. So thank you for taking the time out of your busy schedule. As I said, you will be receiving an email with the recording of this event and a link to the application and a link to the deposit payment. So if you are interested in progressing your application, I would advise that you do pay before the discount deadline to secure that discount. But our education advisors will be reaching out to you in person by phone in the coming days to make sure that you're happy with the information you received today and to see if they can help you with your application process. So thank you for everything and thank you for joining us today, and hopefully we'll see you soon in October.
Thank you.
Thanks so much. Thank you so much, John.
Bye-bye.
Bye.